Pneumonia warning signs, symptoms, causes and powerful home remedies. Pneumonia. It kills more than 2.5 million people every year. But what if we told you that knowing just a few symptoms early, and using a handful of simple remedies, could save a life? And yet, millions don't even recognize the early warning signs until it's too late. But today, we're revealing the hidden symptoms, the causes you didn't expect, and powerful home remedies that could protect you and your loved ones, starting right now. If you care about your health, your family, or someone at risk, pause, don't just watch. Like this video, share it with someone who needs it, and hit subscribe for life-saving health content every week. This is Pneumonia Warning Signs, Symptoms, Causes and Powerful Home Remedies. Let's begin. 1. What is pneumonia? Let's start with the basics. What exactly is pneumonia? Pneumonia is an infection that happens inside your lungs. You have two lungs, and inside them are tiny air sacs called alveoli. These little sacs are where your body takes in oxygen when you breathe. But when someone has pneumonia, those air sacs fill up with fluid, pus, or mucus, and that makes it very hard to breathe properly. That's why people with pneumonia often feel like they can't catch their breath. They may also cough a lot and feel weak or very tired. Now, here's something many people don't realize. Pneumonia can look and feel just like the flu at first. But it's usually more serious. It can affect just one lung, or both. It can start suddenly, or come on slowly over a few days. It's especially dangerous for babies and young children, seniors over the age of 65, people with chronic illnesses like asthma, heart disease, or diabetes, and those with weak immune systems, like cancer patients or people living with HIV. Globally, pneumonia is a leading cause of death, especially in developing countries. But even in places with good healthcare, it can still be deadly if ignored. The good news: when caught early and treated properly, most people recover completely, especially if they know what signs to look for. That's exactly what we'll explore in the next section: how to spot the warning signs early so you or your loved ones don't wait too long. Stay with us, because recognizing pneumonia early could save your life or someone you love. 2. Early symptoms. Pneumonia. Now that you know what pneumonia is, let's talk about something even more important: how to recognize it before it's too late. Because the truth is, pneumonia often hides in plain sight. It can start off like a regular cold or flu, so many people brush it off. They say, "It's just a cough, I'm a little tired, I'll be fine." But pneumonia doesn't go away that easily, and ignoring it can be dangerous. Most cases of pneumonia begin with a cold in the head or throat. The patient generally feels chill, shivering, difficulty in breathing and sharp pain in the chest. This may be followed by a cough with pinkish sputum which may later become brownish. The patient usually suffers from fever and headache. In more serious cases of pneumonia, the sputum may be of rusty color. In your children, the disease may cause delirium and convulsions. Most patients feel very miserable and sweat profusely. The temperature may rise to 105 OF and pulse may go up to 150 beats per minute. A common complication of all kinds of pneumonia is pleurisy. Symptom 1. Persistent cough. First on the list, a persistent cough. This isn't the occasional throat clear. This is a cough that sticks around, day and night, and it may bring up yellow, green, or even bloody mucus. If you've had a cough for more than a few days, and it keeps getting worse, don't ignore it. Symptom 2. Fever and chills. Your body may spike a high fever, sometimes over 102 degrees Fahrenheit or 39 degrees Celsius. You might sweat 1 minute and shiver the next. This is your body trying to fight off the infection. Symptom 3. Chest pain when breathing or coughing. This one's a red flag. Sharp chest pain. It may feel like a stabbing sensation, especially when you breathe deeply or cough. That pain comes from the infection irritating the lining of your lungs. Symptom 4. Shortness of breath or fast breathing. Pneumonia makes it hard for your lungs to absorb oxygen. So your body tries to breathe faster to get enough air. You might feel like you can't take a deep breath, or like you're always out of breath, even after light activity. Symptom 5. Extreme fatigue and weakness. Feeling tired is normal when you're sick, but pneumonia can make you feel completely drained. People often say they feel like they've been hit by a truck. You may struggle to even get out of bed. Symptom 6. Confusion or mental fog, especially in older adults. This symptom is often missed. Confusion or changes in mental state. Older adults with pneumonia may not have a cough or fever at all. Instead, they become forgetful, disoriented, or sleepy. If someone you love is suddenly acting off, get medical help right away. Symptom 7. Bluish lips or fingertips. This is a serious warning sign. When pneumonia gets bad, your body can't get enough oxygen. That leads to cyanosis, when your lips or fingers start turning blue. This means you need emergency care, immediately. Here's the summary of symptoms. Quick recap. Persistent cough, fever and chills, chest pain, shortness of breath, extreme fatigue, confusion, especially in seniors, bluish lips or fingernails. If you or someone in your home has 2 or more of these symptoms, especially if they're getting worse, don't wait. See a doctor or go to a clinic. The sooner you act, the better your chances of recovery. In the next section, we'll break down the real causes of pneumonia, including some that may surprise you, and how you can protect yourself and your family every single day. 3. Causes of pneumonia. So now you know what pneumonia is, and the symptoms that can help you spot it early. But here's a big question: what actually causes pneumonia? Pneumonia is caused by various types of germs such as Streptococcus, Staphylococcus and Pneumococcus variety. At times, certain viruses are also responsible for the disease. Other causes of diseases are fungal infection, irritation by worms, inhaling foreign matter, irritant dust or noxious gases and vapors such as ammonia, nitrogen dioxide or cadmium. The real cause of pneumonia, however, is the toxic condition of the body, especially of the lungs and air passages, resulting from wrong feeding and faulty lifestyle. Persons with healthy tissues and strong vital force are unlikely to catch pneumonia. It is only when the system is clogged with the toxic matter and the vitality is low that the germs of pneumonia invade a person. Cause number 1. Bacterial infections, most common in adults. First, and most common, bacteria. The number 1 bacterial cause of pneumonia is something called Streptococcus pneumoniae. This type usually hits after you've had the flu or a cold. Your immune system is weak, and the bacteria take advantage. This is why many adults, and especially seniors, develop pneumonia after a cold or virus. Cause number 2. Viral infections, very common in children and older adults. Yes, pneumonia can be caused by common viruses like the flu, RSV, and even COVID-19. This type is more common in young children and older adults. Viral pneumonia often starts with mild symptoms, but can get worse quickly. Cause number 3. Fungal pneumonia, rare, but dangerous. You can actually breathe in fungal spores from soil, bird droppings, or moldy environments. This type usually affects people with weak immune systems, like those on chemotherapy or with HIV. Cause number 4. Aspiration pneumonia, food or liquid in the lungs. Fourth is something called aspiration pneumonia. This happens when food, drink, vomit, or saliva accidentally goes down the wrong pipe and ends up in your lungs. It's more common in people who have trouble swallowing, like stroke patients or elderly people. Other risk factors you must know. Besides the direct causes, here are some major risk factors that can increase your chances of getting pneumonia. Smoking damages lung lining, making it easy for germs to enter. Air pollution irritates lungs and lowers defense. Chronic diseases, like asthma, COPD, diabetes, and heart failure. Weakened immune systems, due to medications or illnesses. Recent surgery or hospital stay, being immobile or on a ventilator increases risk. Age, under 5 or over 65. Your lungs need extra protection. Knowing what causes pneumonia helps you take action before it strikes. In the next part of this video, we'll show you exactly what you can do at home to ease symptoms, and speed up recovery, if you or someone you love is battling pneumonia. 4. Powerful home remedies to fight pneumonia naturally. If you or someone in your home is recovering from pneumonia, or you want to strengthen your lungs naturally, then listen closely. Because right now, we're revealing safe, powerful home remedies that can ease your symptoms, help you breathe easier, and even speed up healing. Important note before we begin. These remedies are meant to support medical treatment, not replace it. If you suspect pneumonia, see a doctor first. But once you've started treatment, these natural solutions can help your body fight back, stronger and faster. Remedy 1. Steam inhalation with eucalyptus or peppermint oil. One of the simplest and most effective ways to clear congestion is steam inhalation. Just boil water, pour it into a bowl, and add a few drops of eucalyptus or peppermint oil. Cover your head with a towel and breathe deeply for 5 to 10 minutes. How it helps. Loosens mucus. Opens up airways. Soothes inflamed lungs. Tip. Do this 2 to 3 times a day, especially before bed. Remedy 2. Ginger and honey tea. Next up, ginger and honey tea. Ginger fights infection and reduces inflammation. Honey coats your throat and eases coughing. How to make it. Boil a few slices of fresh ginger in water for 10 minutes. Add a teaspoon of honey. Squeeze in a little lemon juice for extra vitamin C. Drink 2 to 3 cups daily for best results. Remedy 3. Garlic, nature's antibiotic. Did you know garlic has natural antibiotic and antiviral properties? It's been used for centuries to fight lung infections. How to use. Crush 1 to 2 cloves of garlic. Mix with a spoon of honey. Take once or twice daily on an empty stomach. Bonus. It boosts immunity and helps clear chest congestion. Remedy 4. Turmeric milk, golden milk. Turmeric is a powerful anti-inflammatory. When mixed with warm milk, it becomes a healing drink known as golden milk. How to prepare. Warm 1 cup of milk, dairy or plant-based. Stir in 1/2 teaspoon turmeric powder. Add a pinch of black pepper, it helps your body absorb the turmeric. Optional. Add honey or cinnamon. Drink before bedtime to reduce inflammation and support healing overnight. Remedy 5. Stay hydrated with warm fluids. Hydration is crucial when you have pneumonia. Fluids help thin the mucus in your lungs, making it easier to cough out. Best options. Warm water. Herbal teas. Chicken soup. Fresh vegetable broths. Avoid cold drinks. Sugary sodas. Alcohol and caffeine. Tip. Aim for at least 8 to 10 cups a day, more if you have fever. Remedy 6. Lung cleansing foods. What you eat matters. Choose lung-friendly foods rich in antioxidants, vitamins, and minerals. Top lung healing foods. Leafy greens like spinach and kale. Citrus fruits, oranges, lemons. Apples support lung function. Carrots rich in beta-carotene. Walnuts contain omega-3s. Garlic and onions natural lung cleansers. Avoid processed foods. Deep-fried items. Excess dairy can increase mucus for some people. Remedy 7. Rest and controlled breathing. When fighting pneumonia, your body needs rest, lots of it. But gentle breathing exercises can help keep your lungs strong while you recover. Try this simple exercise. Sit up straight. Inhale deeply through your nose for 4 seconds. Hold for 2 seconds. Exhale slowly through your mouth for 6 seconds. Do this 5 to 10 times, 2 to 3 times a day. It helps keep your lungs open, reduces shortness of breath, and prevents fluid buildup. Remedy 8. Elevate your upper body while sleeping. Lying flat can make it harder to breathe when you have pneumonia. Instead, prop up your upper body with extra pillows or sleep in a reclining chair. This helps drain mucus, reduce coughing, improve oxygen flow. Remedy 9. Use a humidifier. Dry air can irritate your lungs. Using a humidifier adds moisture to the air, making it easier to breathe and keeping your lungs soothed. Tip. Clean your humidifier daily to prevent mold or bacteria buildup. Remedy 10. Build immunity naturally. And finally, support your immune system to heal faster and prevent future infections. Simple steps. Get 10 to 15 minutes of sunlight daily for vitamin D. Eat balanced, nutritious meals. Take a multivitamin if recommended by your doctor. Avoid stress and get enough sleep. Wash your hands regularly. Stay away from smoke and pollution. Pneumonia is serious, but with early treatment and smart home care, most people make a full recovery. And now, you have the tools to support your healing the natural way. Final life-saving tips. Pneumonia can go from mild to deadly very quickly. So how do you know when it's time to stop home care and go straight to the doctor? When high fever that won't go down. Breathing that's fast or painful. Bluish lips or fingertips. Severe weakness or confusion. Coughing up blood. Chest pain that worsens when breathing. Don't wait. These are signs that the infection could be spreading fast, and you need medical help right away. Still not sure if it's serious? That's okay. It's always better to be safe. Call a doctor, describe the symptoms, and let them guide you. If this video helped you understand pneumonia even a little better, please give it a like. Share it with your friends, parents, or neighbors, it could literally save a life. And don't forget to subscribe for more powerful, life-saving health videos every single day. Take care of your lungs. Take care of each other. We'll see you in the next video.